Hello, my name is Wei Tong. Welcome back to the channel. I am a coach in ENSŌ Powerlifting, and I also serve as a physiotherapist in my day job. So, all the questions that my athletes who have been injured, they always ask me is, why do I keep getting injured over the same issue within the same period of time? So let's say weeks and months. So the first thing to understand is what is going on. Then thereafter, we want to talk about what we can do to facilitate the whole process. So, the first concept that I want to introduce to you guys is the boom bust cycle. So, the boom bust cycle refers to this vicious cycle of, let's say, you get injured and then you are taking some time off. Let's say I take 2 days off. I have like a low back strain from doing the squat. I take it easy for 2 days and then I want to catch up. So as I catch up and I go back to my normal training, I overdo it and I experience even more pain. And then I take another 2 more days and then it just keeps repeating itself. So the mechanism that we're hoping to help with us in this particular case is, I rest. So when I rest, I get better and the pain goes away and I try to go back again to my normal working loads and it comes back again and the cycle keeps repeating. So this is the boom bust cycle. But what's more insidious, right? It's the fact that underneath all of this is that your capacity, the tissue capacity, actually decreases over time. So in this chart, we have the declining activity level, but one thing that you can take note of is, okay, without the targeted work, without addressing the underlying issue, sometimes the tissue gets weaker. So if you're looking at the low back in particular, and if it's like, let's say, a low back strain due to weakness of the erector spinae, then as you take rest and as the pain subsides, the inflammatory processes calm down, you go back to squatting. But actually, your low back didn't actually get stronger during this period of time. The 2 days of rest is really meant to reduce the pain and the inflammation, but there's no targeted work to address the deficiencies in the tissue strength and tolerance. So you will notice that over time, if you keep flaring up these kind of issues and pain, right, it doesn't go away. And that's the first thing. And the second thing is, each time it flares out, right, you are getting more demotivated, more frustrated, and you try to get back to the same level again and again. And you notice that the pain can flare up and you just keep spiking this kind of graph that you're seeing here. So this is just something to take note of. Now that you know that cycle exists with this, then the awareness is there. So what do we do? So one of the things that you can try out is to get the graph to look like what's on the second page, like here. Okay, all these images you can find on Google through just googling boom bust cycle. Yeah, you have to include that it's injury based. If not, they'll give you the economics version. Anyways, it's basically to break this cycle and to make sure that we are looking at what the tissue can do. We're looking at the function of like your physical function, and we are trying to aim for gradual improvement in the function. And even though you have symptoms that flare up here and there, that is like a positive slope rather than a negative downward slope. This is graphics prepared by E3 Rehab, and they're looking specifically at tendinopathy rehab. But basically, the visual analogy applies to any kind of minor strain or tendon issues that you might be facing. And in terms of load management, it is quite similar. Okay, so coming from my personal experiences as someone who has been injured, someone who has coached powerlifting athletes who are injured, and as a physiotherapist, I'll just share all my experiences. I'll say as a person, if you're experiencing this or if you're coaching someone who is going through this, give them a longer runway, give yourself a longer runway. One of the things to take note of is once the pain subsides, right, the tendency is to, okay, I am cleared to go, I should go now. But because of how the symptoms of inflammation and the pain works, right, we do want to be very aware that the tissue capacity hasn't caught up yet. So we want to give yourself a much longer runway. If let's say last time you give yourself 2 days, give yourself 4 days. If it's been spiking up over weeks, then you should give yourself months. The idea here is take as much time as you need to get through this phase properly, rather than to rush it and spiral again into the next boom bust cycle. Okay? Taking twice as long as before, I think that's a good rule of thumb, especially if you think that you are being a little bit more impatient. So what you can do is experiment with this. Let's say if you take 2 days off and it's not sufficient, your pain flares up at about 5 out of 10, and take 4 days off and see what that gives you. If it flares up to 3 out of 10, if that's within the capacity and threshold that you and your coach have discussed, then by all means stay with it. If not, take 8 days, take 8 days of like lighter workloads just to see what's going on. I think in terms of like training modification, it's something that you have to discuss with your coach, whether or not is it decreasing volume, decreasing volume or decreasing intensity. It's just something that you have to work out within the scope of your program and what your current training goals are. Other things is to focus on basically different training qualities. So let's say you are injured in the squat, going with the example again, you can still squat because you still want to have it as a barometer, as a thermometer to measure like, okay, what's going on here? Are we getting better in terms of the strength? Are we getting worse in terms of the pain levels? But then again, the focus should change as well. So whatever got you to the injury in the first place, it meant that there was a lot of things that were underlying that were not addressed. So we want to look at motor control. We're going to look at the intent that you're carrying out the movement with, and we're going to look at technique. So I'm going to do a little bit of a deep dive here regarding these 3 points. So again, referring to squat, motor control wise, we want to see if you are able to get in and out of the position, bottom of the squat, up all the way to the top, with good control, whether or not you are offloading the injured side. So let's say, right, you have a painful knee on the left side. The tendency to happen is the body will shift itself away from the injured affected area to offload the left knee. And if that's happening for you, the first thing that we want to do is to catch it first and to make sure that we are still squatting with the correct technique, with the appropriate technique, and we are not intentionally trying to just offload or even unintentionally trying to offload that particular knee just to make sure that, the pain doesn't spike. Because what happens at the end of the day, let's say 6 weeks later, your pain subsides, but your technique just changed so much during these 6 weeks that you're not aware of, and now you have to like fix that particular issue again. And as you fix it and you try to load the left knee again, what happens? The pain spikes in because the underlying tissue quality was not addressed because the squat was offloaded on the left side, so it repeats itself. So you can see how like maintaining motor control is very important here, making sure that you as the lifter, you are in control, okay, and that the muscle that you're working on is really able to fire, able to help you with the movement, rather than like it switching off and you'll get other compensatory movements going on. And intent, I think this comes back down to quite a lot of intangible things. One thing to take note of is what phase of your training are you in, and what kind of training personality do you have? Are you the kind of person who will push through the pain? Are you the kind of person who will take it a little bit too easy on yourself with regards to the exercise? Are you prepping for a competition right now? Because if you are, then that puts a little bit of a different pressure, a little bit of a different mindset for yourself, in the sense that, okay, I have a competition coming up in 6 weeks. I need to be able to squat, and I need to get back to squatting as soon as possible. So, um, with my Singaporean athletes, the context is like the anxiety of the deadline and the competition tends to override their ability to really just feel that their pain is there, the discomfort is there, the motor quality is like gone, the technique is gone, but they're actually able to like really ignore all of these signals, and it's a really strong reason why they got injured in the first place. So taking that step back to recognize that, hey, I am moving with the intent not to get better at the movement. I am moving in the intent to make sure that I can perform 6 weeks later. And that got me into this current situation. And I think that's something very important to acknowledge emotionally and psychologically as an athlete. And then taking a step back to be like, okay, reflecting back on the strain, I was ignoring a lot of things. The left knee has actually been bothering me for a while, but I was just like a bit more concerned with the outcomes. So that's intent. I think I covered intent before in the previous video, talking about how you approach accessories. Is really about how you approach your training in this particular instance, and what kind of particular goals you have with that lift or that exercise. So I think another example is if you are pushing very hard for a record, then that's something to just take note of, because let's say if you are very close to a deadlift record and you are just very hungry, you can like almost see your mind's eye that you are holding a national record, then the way you're going to approach training is going to be a little bit different, a lot more pressure on yourself. Again, it comes back to your goals, your circumstances, so be really mindful of this. The last part is technique. So it comes back to motor control again, in the sense that, okay, we know that the technique would change if there's pain involved, but leading up to the incident of the strain itself, what was the technique like? For example, I think very classic scenario is that in a conventional deadlift, that as you increase the intensity and as you increase the number of repetitions that you have to do, quite a few people in their beginning years with the conventional deadlift will start to round their back. So when that happens, the speed will stay the same or even like increase. So they start to slack off on the lumbar extension, on the thoracic extension, and they use that as like a justification to keep the RP the same or keep moving up the weight, or as the set gets longer and longer, that they just try to get the weight moving from point A to point B without any regards to the technical thresholds. Same can happen with the squat, in terms of another classic example is the knee caving in. A little bit more prominent for female powerlifters, but in that case, the knee caving in, and as the quads, the hip extensors fatigue, then the knees will come in, and the lifter just does not pay attention to the breakdown, and that happens over like periods of weeks to months, and that leads to development of very poor control and poor positional strength. Then when the time comes that, okay, I have survived past 3 weeks, and then the fourth week when I'm loaded a little bit more and my technique breaks down a little bit more, and the whole straw house collapses. So this is something to think of. So what got you injured in the first place? Have we addressed that? And were there any technical breakdowns on the way there? Then if that's the case, it's very important to take a step back and look at the technical standards that you have been approaching that particular lift with, and to make sure that during this period of time, as you are getting your tissue capacity back up again, that you are addressing the technique. Okay, then what are the other things you can do during this period of time is to focus on the other lifts. So if you cannot squat, you go and bench more, focus on getting your triceps strong. If you can similarly can deadlift, let's say your hamstring has a strain, then by all means get freakishly strong at rowing. Give your upper back the stimulus that perhaps it wasn't getting as you await the return of the tissue capacity and the subsiding of the pain. So as an athlete, right, and perhaps as a coach, I think this is a very useful tool, because in powerlifting we have 3 lifts that we can like cycle around, and with the 3 lifts we have also their respective variants, and with the accessories. So if you have one particular area that is like really like giving you a particular issue, then stay away from it. Focus your energies and reserves on pushing hard in the areas that you can, the healthy areas. Again, keeping in mind that perhaps what got you injured in the first place must be addressed first. So if it's competition pressure, if it's breakdown techniques, you want to make sure that you don't carry forward all these issues and errors into your other lifts. Then you'll be dealing with multiple like injuries at that point of time. But it's a very good way of like making sure that the athlete keeps motivated and you can still see progress elsewhere while you're waiting for the tissue to get back to speed. So I did not address one particular point as to, okay, I have an injury in my low back, so what can I do for that low back? Or I can swap out for any particular body part that you're injured in. I think that goes beyond the scope of this particular video. I just want to point out the psychological phenomenon that is going on, physiological component of the Bumba cycle, making sure that you are breaking this cycle and that we are not going through a vicious spiral downwards in terms of like the symptoms, the flare-ups. When you are talking about specific strain that you're dealing with, right, it's more important to have that consultation with a medical professional. You can talk to a coach, you can talk to strength and conditioning professionals, you can talk to a physiotherapist. It's good to get a diagnosis and from there get very targeted exercises meant to deal with that particular knee pain or that shoulder pain that you've been like ignoring. Then while that is happening, you want to give yourself focus on your sport because you still have a competition to prepare for or like a peaking that you're going through. So first off, really just understand this phenomenon. Then make sure that you are focusing on the training qualities that perhaps you were not conscious of. And then lastly is to focus on the other lifts, the other areas that you can still push so that you get that psychological boost as an athlete that, okay, I'm still pushing hard, I'm still working hard, this is still the sport that I love. And of course, give yourself a longer runway. Okay, at the end of the day, if you take 4 weeks off, it's better than taking 4 months off because if you keep ignoring a strain, it will come back to bite you. And when it does, it's not going to be as forgiving as the first time that it did. Okay, that's all from me. I'm going to plug for myself here. If you have any questions, comments, you can drop us a DM on Instagram. You can leave down a comment. If you have any questions as well regarding like our coaching services, just come to our website, take a look. Otherwise, that's all for today. If you have friends, training partners who are going through this particular issue and you're like, they keep pushing themselves and they keep hitting the wall, but I want them to like understand what's going on because I don't really want to see them keep like going through the same process again. You can send them this video. I think as a coach as well, if you have an athlete who is being frustrated at what's going on, I think this is something that you can lean on as a resource. Try it out. Let me know if it works. And yeah, every time that you share this video, I think it helps one particular person who is going through an issue. And yeah, I think at the end of the day, we just want to participate in the sport that we love. I think that's really why that's driving the Boomba cycle, right? Okay, that's all for today. Have a good one.